Good afternoon, and a few words to say on this very special Better Health recording before I introduce our guests for a very difficult conversation about those who are left behind by suicide. I want to read something. If you've ever thought of suicide, if you're thinking about that now, I want you to listen to this. Sometimes you can take life a day at a time. Sometimes you can take just an hour at a time. And sometimes all you can do is this very moment, hand over hand until the next moment is given. In these times, be very gentle to yourself. And that reminded me of what Philip Tyler, our guest today to tell the story of how his family's been touched by the death of his son, about the message that Devin left for his family. His last message, which was, life is chaos, be kind. So be kind to yourself. And I do want to introduce now Philip Tyler, who's here because he is now burning to tell this story and reach out to others. And we've also invited Dr. Matt Layton to join us. Matt is an old friend who is a psychiatrist, physician, father, and to provide some professional advice as we carry on this conversation.
Thank you so much.
So, Philip, I wanted to give you the chance first to tell your story. That's why we're here.
Yeah. Well, my story, it begins January 6, 1995, when my son Devin was born. And it ended, tragically, November 28th, 2017. And, the grief that comes with suicide is especially complex and traumatic, because we are, we're left reeling with the questions about why and could we have done something differently. But, what I have come to realize is that we're also really left with what in society is stigma, shame, and isolation. But in the face of this, I refuse to remain silent. Silence is not strength. And it was important for me and my family to tell Devin's story because what he wanted, what his message was to us in those videos that he left for his family was to, celebrate the important things in life. Think about others. Think about the things that others are going through. Think about how you can make an impact on someone who might be struggling. And it was really important for me to then get out front of this and tell the story of my son. And, he didn't have the outward signs of depression. He didn't reach out to anyone, his family or friends. What we realized, obviously, thereafter was we all received messages at around 8:40 the night before. And he just, as every other day, sent us loving messages of, he loved us. He missed us. He stopped by my home to drop off some McDonald's cookies like he always did. And, unfortunately, I wasn't there. I was at City Hall testifying. But it didn't raise any flags. It didn't raise any alarms. I look back on it now. Collectively, we look back on it, and it was his way of saying goodbye to us. But this is our way. This is my way of bringing this message out from the shadows, out from the secrecy, out from the shame, the stigma of suicide, because we shouldn't be shameful. It shouldn't be stigmatized. And together we can change lives. Together we must change lives. This is a profound societal problem. Suicide takes more lives than homicide annually, but yet it doesn't get the media attention. And that's why I'm so thankful for Spokane Talks Online, Solani and Kent, and Steve. I'm so thankful for the spokesman, for my friends like Whitney Ward and Stephanie Vigil, who give me the platform to talk about this epidemic that's impacting all of us. Not just parents, families, community, the LGBTQ, our Native American brothers and sisters, our Alaskan natives, our veterans.
There's no community that is not touched
Yeah.
by suicide, and this is not a partisan issue or partisan problem. It's a family and community tragedy,
Yeah.
and
And
it
I
affects
can-
everybody.
I will tell you this community, this Spokane community, including those sitting in this room today, have been more than wonderful for me and anyone who's out there who is struggling with depression or issues that might bring you to that ultimate decision. You're not alone. We are there for you. Please reach out. You know, and I've told people then, and I'll tell them now, just ask 3 simple questions. You know, how are you doing? How are things going? And how can I help you? And I think that's where it starts.
And do it looking somebody in the eye and
Absolutely.
really listening
Yeah,
to
this
the
is not about text. This is not about Instagram. This is not about Twitter. This is about having a conversation with someone and truly listening actively and empathetically. And in situations like this, you're going to do more listening than talking. It's going to be more of a monologue than a dialogue, but that's okay. That's what we need. That's what they need. It's so
You know,
important.
When you and I visited before this was scheduled, one of the things we talked about was how with the rise of social media, and a smart kid will kind of cultivate their image, right? Everybody's got this public image, and even more so than before, it was not just public in your little neighborhood. Now it's public worldwide, and the smart kids know that.
Yeah.
And so they're very careful about what they share, and so it becomes even more important to make those face-to-face personal connections and make them real. Make them real. Matt, you've just come back from a training for physicians on, and I think you've got some information to share with us on things that people can do when they're doing that active listening and how to react.
You mentioned no community is spared by suicide, and so what I did on Saturday, the coincidence is that I met my Washington State requirement as a licensed healthcare provider to have a 6-hour continuing medical education, and that happened in Spokane here. I'm a psychiatrist. It was presented by the Washington State Psychiatric Association, and I'm happy to say that a former psychiatry resident of mine that I trained almost 20 years ago was presenting this statewide suicide training.
That always makes a teacher feel good.
It does make it good. We've given back to the next generation, and he, I believe, did a wonderful job equipping the physicians who were there with the common sense approach that we need to be able to have these conversations and stay connected when someone is in a crisis.
So in that empathetic listening, what's something that people can think about doing? It seems so dangerous, really, to listen with that kind of intensity.
I think that for us as providers, if you're in a situation where someone has come to my office and says anything along the lines of, I would not want to wake up, or I feel sometimes like my family would be better off without me, we can't let that just go by. We have to pick up on that and make sure that we follow it up with the statement or the comment, whatever it is. You said you were feeling hopeless. And then ask the question, have you thought about hurting yourself? Have you actually thought about suicide? And taking the next step actually is helping. And it provides a pressure relief. That person, if they're thinking about it, it helps them to release that pressure for you to ask that question. And people have said, well, will I plant the thought in their head if I ask about a question? And it's been well documented that that's not the case. And that asking the question helps them feel connected. And the other thing is to say, I don't know what to say, but I don't want you to feel alone.
I know it was particularly hard for your family, Philip, because there were no signs. Only in hindsight can you figure out, how to connect those dots. And I think the grief from that is unimaginable. Our family's been touched by suicide, but there were some warning signs in a way, but still, it didn't help, and it's just really hard to know what to do. I know that we have put up a couple of numbers that they'll roll on the screen while we're recording this. One is to a crisis helpline, which is a basic phone a phone-based one. The other one is to a text line. And so for younger people that are used to more communication by text, there is a way, a really good program where one could, if you're feeling that, if things feel hopeless, if it's too hard, if it seems like it's too hard, and it shouldn't be, if it seems like it's too hard to talk to friends and family, to at least talk to somebody. There is always somebody. You had some information there that you'd.
Well, I think what's important, and this is, I want to say this on a personal level, no one can predict suicide. Okay? There are risk factors. And we can talk about risks and risks that, but none of those in and of themselves can tell us this person is going to commit suicide. So that's a relief in many ways, to be able to reflect and know that, well, if I may have missed this or I may have missed that, there are professionals who are trained to do this who cannot predict who is going to actually follow through. So I hope that's also a relief.
Sure.
But it's showing you care. If you ask the question and you're involved and you do the active listening, then the person actually knows you're curious and you care enough to pay attention to me. And that often may be the one thing that they need to keep them from following through on an act that they've thought about already. And if you are the one person who can offer some hope and show that you care in that moment, I guarantee you it can be a difference in life or death.
So what are some things that we can do to get over the stigma? How come we can't talk about this? It's truly an epidemic, right? It's like you said, statistics are, it's a way bigger problem than homicide. It's suicide that's the big problem. We don't talk about it.
I will tell you this as a father and as a African-American father. I was raised to be tough and strong and outwardly facing, to have grit. And I raised my sons the same way. But as I grew older, I understood that being strong, being real, being tough, and I'm talking to all my fathers out there in every community. Being a real man doesn't mean you can't cry, doesn't mean you can't reach out for help, doesn't mean you can't be comforting. And it surely doesn't mean you hold on to a secret if someone tells you that they're thinking about something like this. Real men express their feelings. And to all the mothers out there, love your sons and daughters. Teach them how to be caring. Teach them how to be loving. Love them every day.
It's interesting that you put it that way with that stoicism. There are a number of communities where that exists. And I know that in my own community and culture, which is the Germans from Russia, and you're I come from a very stoic community where you don't admit weakness easily to anybody, and it's really hard. And so I know that I've made it a practice when there's a friend or a neighbor that I know is having a tough time, to say, I understand you want to do this yourself, but just know that if you decide you need to cry uncle, you need help, you can call me, and I'll figure out how we can help you as a community. But you have permission to be weak, and sometimes I think giving people that you have permission to fail at this, to be weak at this, to have a bad moment, and to be a safe place. I think also maybe for our kids, one of the things that we could teach them is it's okay. You need to think about who you surround yourself with.
Absolutely.
And do you have people around you that you can be weak with, that you can admit failure to? You don't have to be, going around admitting failure every day, but do you have people that you could do that with if you need it, and not if you need it, when you need it, because everybody will need
everybody
that.
will need it from time to time.
So make sure you cultivate some friends you can be a failure with.
and I have to say this one thing too. It's important that when we talk about suicide and depression and these kind of things, I really want to stress that those that came to help us, those that came to support us, the firefighters, the first responders, our law enforcement professionals, they too need to be able to be, I don't want to use the term weak, but they need to be able to reach out too. They see this all the time.
Vulnerable.
You know, we vulnerable. Yes, thank you, Matt. You know, we as parents, hopefully never have to see this. We did. His mother did, and she'll struggle, and I'll struggle. But there are professionals out there that see it every day, and they need just as much help, care, and compassion as we do.
And as a first responder, you can't always predict what's going to bring back some old call, or what call is going to affect you because of what you carry with you in your past as well. And it'll sneak up on you.
And you
hit
speak
you
from
right,
personal experience.
I speak from personal experience. It'll hit you right up the backside of the head.
I can relate in psychiatry as well. And I think just to close, when you were talking about stigma and how can we reduce the stigma, normalizing it is one of the things that we can do, because stigma has to do with things being on the margin, but often it's just ignorance and fear that creates that. So one way to approach this is to say, so you're saying you're pretty stressed out. So a lot of times when people get that stressed out, they start feeling down or sad or pulling away. And suddenly they may see that, okay, I've been feeling so alone, like nobody cared, and suddenly you're reaching out and making this observation that maybe I'm not the only one who's going through this. And maybe it is actually kind of common for this to happen, for people to get very depressed, for people to get so anxious or overwhelmed that they think there's no way out.
There was another article that I was reading talking about how frequently someone who has been feeling kind of spiraling down like that will have made one or more visits to primary care physicians in the time leading up to it. Maybe because the stress causes physical ailment. It's easier to admit physical illness than it is that you're struggling with something emotionally. I know something you and I have talked about a lot, Matt, and in a couple different settings is how you've been trying to work with pulling mental health care back into primary instead of like this odd. It's not like you have a broken bone. It's not. You don't need an orthopedic specialist. It's part of primary. And I was interested in how the new medical school is doing that, and just that philosophy, because that's something that I think if more people recognize the need to do that push. You would get some push from patients to help you with that quest. So tell us a little bit about that.
First of all, I think I'd be a terrible heart surgeon. That's kind of what happened. And then I experienced psychiatry as an opportunity to see people in their whole lives. And so now, instead of the biomedical sciences, we talk about the biological, psychological, social, and spiritual approach to wholeness and to health. And so for the next generation of physicians that we're training, for example, through Washington State University, they won't make the distinction between brain and mind and behavior. They're all part of this individual. And as you said earlier, it's not if, it's when. As an individual, we all have unique biological, psychological, social, and spiritual needs in order to achieve health.
Yeah, and that's that's probably more applicable to women who contemplate, because women are more likely to seek medical care. Guys from every community are more likely to say, suck it up.
And it's easier, as you said, to go to the doctor and say, I'm having headaches, or I'm having stomach problems.
Can't sleep.
Rather than say, I'm feeling, and they may not really feel sad. I think that's the other thing. Not everybody who gets into the situation feels sad. There are a lot of reasons why people get there. They're anxious, they're overwhelmed, they feel trapped. And so that's where I really appreciated your appeal earlier for anyone listening. If you're feeling hopeless or trapped, there are times where if you can get through 5 minutes and call somebody and talk with somebody, that may save your life.
Hopeless it isn't forever. Sure. It can come out the other side, and that's a hard thing, especially for young people, to realize that it's not. This moment is not forever. This moment does not define. This moment does not define you.
Yeah.
Whatever it is that's driven you to feel that way. I've got a little wrap-up story of my own, but if I'd like to give you each a chance to, what one last thing would you like to let people know to help start their own difficult conversations? Yeah,
one of the things I would say is again, just don't remain silent. We start destigmatizing these issues by talking about them. And that is what my purpose is going to be going forward. I want to talk about this. I want to bring this out into a conversation we should be having. We should have been having, and we should carry on from this point forward. But I really want to talk about, lastly, the number, and it's probably rolled across the screen as we've spoken today, but 1-800-273-8255. Remember it, write it down, put it in your phone. If you're feeling that way anyway, if you know someone that is feeling that way anyway, call the number. There are wonderful resources out there, from YB Men Project to the Suicide Prevention Hotline to the American Foundation for Suicide Prevention to Spokane Cares. These agencies must be supported, and they must be illuminated in the good work that they do.
And if you know any first responders in your life, you can probably ask them, because they know all about it as well.
And tell them you care about the work that they do, and that you're grateful for that. I think every opportunity to express our gratitude. But my final message would also be to get help. And having worked on inpatient psychiatric units where people are suicidally depressed and think that this is the end of the world, that they ended up in that position, it was very important to see that 15 years later, over 90% of those people had not committed suicide and had not died by suicide. And so treatment does work, and reaching out can help with that feeling of loneliness. And for those of you who are wondering what to do, again, sometimes the best thing is to say, I don't know what to say, but I'm here for you.
When, as a child, I watched my father struggle with, now they'd call it seasonal affective disorder. It has a nifty name. And he would, sometime between Thanksgiving and Christmas, he would stop talking to us. He was still functioning well at work, never affected that, but at home, he would go silent. And it would last until from about a month before winter solstice to about a month after. There's definite connection there. And he struggled with that for a long time, and he finally had a doctor that had the right prescription. It wasn't drugs. For him, it was more physical activity, joining a volleyball, getting into something that got him moving every week at a regular, getting him going. And even after he had found some coping mechanisms, you could still see that sadness would drift in for a couple of months, and he dealt with that all his life. So I knew what that looked like. So when I was a young woman, actually about Devin's age, I recognized that I had the same drift, completely functional at work, and there are a lot of people that have that kind of functional depression, but not really coping well, and not really sure why. And one of those times when you're in your 20s, when you're trying to figure out exactly what you're doing and where your career is going and what are you doing with the job and how, what does the rest of your life look like? Because you've kind of finished a bunch of things and clicked off, you've maybe graduated and you've checked off some things, and then you're at the list ends. And that can be a very disorienting time for someone at that age, the same age as Devin. And I realized that how much I had drifted in reading the Psalms. And when you read the Psalms, they're full of a lot of despair. And I realized there was one that resonated so deeply with me that I realized I was at the bottom of that well. And for me, I didn't plan this actually, but for me, I found myself reading that psalm over and over, and just sitting at the back of the choir, just crying my eyes out in the back row of the choir, hoping nobody could notice. I'm sure everybody could see it, and of course, because we're all stoic, nobody said anything later. But I reached out to God. I said, I just need a hand. I need a hand, and I really felt the hand of Christ haul me out of that well. But I used that psalm for the next. It took me about 5 years to get to a point where I didn't need to go back and check. But if I started feeling like I was drifting, I go back and I'd read that psalm, and if I could feel a little bit of a harmonic resonance there, I knew I needed to do things. I needed to find activity, I needed to talk to somebody, I needed to do something else. Whatever it is that tells you that you're drifting, and you need to find a hand to hold on to, you need to find help, you need to reach out. Whatever it is, find something that will help, let you remind you that you can make it to the next moment. You can make it to the next moment. That this is not forever. That you will leave a big hole behind you. And you can hang on. And for me, it was Psalm 143. Verse 4, and it was, my spirit is overwhelmed within me, my heart within me is desolate. And when I read that piece, and whatever it is does it for you, figure this out about yourself. And remember to reach out and find out what are those coping mechanisms that you need to make it past this moment, to the next moment, to the next. Because there is chaos in life. Life is chaos. Be very gentle with yourself. Be kind to yourself, and be kind to others.